Good afternoon, everyone. I am Hilda Cox-Bollin, Acting Secretary General of the Caribbean Broadcasting Union. Welcome to our viewers and listeners throughout the region. Today, the Caribbean Disaster Emergency Management Agency, CDEMA, is partnering with the Caribbean Broadcasting Union, the CBU, and through our Memorandum of Understanding to facilitate CDEMA's annual press conference on the hurricane season for 2020. I will now hand over to our moderator, Mr. Anthony Green, Programming Content Manager, Starcom Network, Barbados. Anthony?
Thank you very much, Hilda. A wonderful good afternoon to all. Good afternoon to the panelists, and a special good afternoon to all those who are representing the media across the Caribbean, the CDEMA's annual press conference, 2020 Atlantic Hurricane Season Regional Preparedness. And indeed, we know that this is a time when we will be on alert for the hurricane season, but it also comes at a time when we have COVID-19 dealing with, and there's also another dimension of drought as well that has been added to the equation. This conference, of course, is held annually. We thank CDEMA for bringing, taking the lead where preparation and awareness is concerned. There.
Anthony, are you there?
Yes, you can hear me? I'm sorry,
yes,
Hilda.
We're hearing you now again, yes.
Great. Yeah, so I was just making the point that because of the situation, we are having this conference virtually. And we thank the media houses for making yourselves available. You will be given an opportunity to ask your questions. Just a bit of housekeeping before we begin. We would want all who are on the Zoom meeting to keep your mic muted. And that's important because of course, the background noise, you wouldn't want that to be a distraction. We would want you only to unmute when you're speaking. You can raise the virtual hand to speak, and you can also wait to be acknowledged by me when you are raising your hands to speak. You can also ask questions in the chat that's available, and each person, you should identify yourself by stating the name, media house, and the entity that you are representing. We're going to get started. First, to give opening remarks and to take a look. Good afternoon to you, Andrea. You need to unmute before you go.
Thank you very much, Mr. Moderator. Good evening, everyone. I want to acknowledge my fellow panelists, Mr. Dario Brathwaite, the UN Resident Coordinator for Barbados and the OECS, Ms. Elizabeth Riley, the Executive Director acting at CDEMA, participating states who are joining, members of the Disaster Management Fraternity, the partners, and the media. CDEMA has made a commitment to convening this annual press briefing at the start of the hurricane season because we see it as an important space to communicate not just with Barbados, but with the Caribbean community. The work we undertake and the messages we share are in keeping with the agency's philosophy of saving lives through CDM. At the outset of this engagement, therefore, we want to share with you the latest forecast for the hurricane season issued today, June 4th, 2020, by the Colorado State University. The forecast indicates a slight increase to their preliminary forecast for the 2020 Atlantic Basin hurricane season and predicts that the season will have well above average activity. The Colorado State University updated forecast states that information obtained through May 2020 indicates that the 2020 Atlantic hurricane season will have activity above the 1981 to 2010 average. Noting that tropical storms Arthur, Bertha, and Cristobal have formed in the Atlantic as of June 2nd, they estimate that 2020 will have 9 hurricanes, 16 named storms, with 4 major hurricanes of category 3, 4, and 5 strength. They also expect that the Atlantic Basin accumulated cyclone energy and net tropical cyclone activity in 2020 to be approximately 150% of their long-term averages. This is also in keeping with the National Oceanic and Atmospheric Administration's Climate Prediction Center, who is also forecasting an above normal 2020 hurricane season. The outlook predicts a 60% chance of an above normal season, a 30% chance of a near normal season, and only a 10% chance of a below normal season. And they're predicted it with a 70% confidence. As you are aware, the average hurricane season produces 12 named storms, of which 6 become hurricanes, including 3 major hurricanes. So those figures show you that we will be well above that rate. These predictions are occurring at a time when the region has been grappling with a multi-hazard scenario since January 2020, starting with a drought and followed by the COVID-19 pandemic outbreak. Notwithstanding, guided by the results of the national, institutional, and regional after-action reviews, CDEMA has been working diligently to incorporate the lessons learned and recommendations from past events to enhance our regional response mechanism. As a region, we have been able to navigate the COVID-19 outbreak with only a few deaths occurring. And this is testimony to the preparedness and regional solidarity that we have had as a region. And we certainly can leverage this as we go into the 2020 hurricane season. Enhanced coordination capabilities through established partnerships with key regional and international partners, including the Caribbean Institute for Meteorology and Hydrology, CIMH, the Regional Security System, RSS, the Caribbean Public Health Agency, CARFA, the CARCOM Impacts, and the United Nations agencies. Together, we can work as we seek to ensure that the region is able to face 2020 hurricane season and the multi-hazard scenario strong as one Caribbean. Thank you.
Thank you very much. So Ms. Andrea Grosvenor, Deputy Executive Director at CDEMA, giving us the overview for the 2020 hurricane season. And as you can see, it started as a very busy season already, and I guess that's an indication of the forecast. To present to us now, we're going to have the United Nations Resident Coordinator in Barbados and OECS, Didier Trabeau. And with more than 16 years in the UN system, Mr. Trabeau has taken office as the United Nations Resident Coordinator at the UN Sub-Regional Office for Barbados and the OECS since January 16, 2019. But previously, he served as UNDP Country Director in Brazil, where he led the design and implementation of a wide development program, both at federal and subnational levels. Among others, he fostered joint programming with other UN entities in support of the Sustainable Development Goals and the Agenda 2030, including initiatives to establish the National SDGs Commission in Brazil and to create partnerships with the private sector for innovative financing of the SDGs. Mr. Trabeau also served as Deputy Resident Representative at UNDP Peru, as Deputy Resident Representative at UNDP Guyana, and as Program Officer and Team Leader of the Crisis Prevention and Recoveries at UNDP India. He led, for example, climate change adaptation and mitigation programs, disaster risk reduction and recovering initiatives, gender equality and sustainable human development endeavors, both in Asia and Latin America and the Caribbean regions. Didier Trabeau, a wonderful good afternoon to you. Welcome to this press conference, and we invite you to present to us.
Good afternoon. Can you hear me, Anthony?
Loud and clear.
Thank you very much for this this introduction. We'll have to think of a smaller, shorter bio for next time. I want to salute Ms. Elizabeth Riley, Executive Director of CDEMA, Ms. Hilda Coxburn, the Secretary General from the Caribbean Broadcast Union, CDEMA team, and all the members of the media and colleagues from the UN also who are online. Really, I want to start by thanking Elizabeth for extending an invitation to the United Nations represented by me today to participate in this press conference. Actually, I feel that this really reflects well the true value we both place in our solid and constant partnerships. So in that sense, the UN is really pleased to continue to strengthen this partnership with CDEMA through the various UN agencies such as OCHA, WFP, PAHO, UNICEF, UNDP, amongst others. And as you may be aware, our recent focus has been, of course, in helping the various Caribbean countries in dealing with the COVID-19 pandemic. And considering that the response has been effective on the health front, as we observe a containment of the spread of the virus. However, we are also mindful that the continuous COVID-19 threat, as well as its expected drastic socio-economic impact, will be simultaneous to the 2020 hurricane season, which is, as Andrea mentioned, in itself predicted to be above average. So this really concretely means for all of us, the countries, CDEMA, all its development partners, such as the United Nations too, that we must really prepare well for the possibility of having to deal with a double crisis and also having to deal with conflicting priorities. So as the UN system, we have, of course, reviewed our preparedness actions and coordination mechanisms, as the objective is to be well positioned to respond to countries through our strong partnerships with CDEMA and especially the regional response mechanisms that exist. And I'll get back to you in greater detail, but I first would like to highlight what is, in our view, important to consider for specifically all Caribbean countries' preparedness in that COVID context. And we first feel as UN team that it's really important to reassess all hurricane response plans and SOPs, if not yet fully completed yet, and SOPs of critical facilities, such as, of course, healthcare facilities. It's also important to complete well the identification of vulnerable groups and especially update that in the context of COVID to ensure a direct response. Thirdly, I would like to mention it's important to secure critical assets, including the emergency response stock and COVID-related supplies, such as PPE and test kits in several locations, of course. Next, I would say that the identification of additional safe shelter capacity, considering the hygiene and social distancing measures, is also, in our view, extremely critical. And finally, I would mention, amongst others, the need of always to strengthen relations with private sector, as they may be a very important element of support in the months to come, if, and hopefully not, but if a natural disaster has to hit a country. Let me turn to the United Nations support to CDEMA and member states. And I would say that main area of support for the UN to CDEMA is on coordination and technical assistance in support of the regional response mechanisms. And as UN, we continue to support, of course, the CDEMA RRM, which is, I understand, also under review. And this has been, a partnership that has lasted for many, many years. And one important element, for example, is the convening of what we call the Eastern Caribbean Development Partner Group for Disaster Management. And Elizabeth Riley, as Executive Director, co-chair this group with me. This is basically established to facilitate the coordination of external emergency assistance. When I say external, with development partners, to the countries of the Eastern Caribbean, and this is being expanded to the whole Caribbean in case of a major disaster. And we have also a modality which is called the Rapid Needs Assessment team that can be activated and deployed in case a disaster hit. And this development partner group has been meeting in the past 2 months on a regular basis to coordinate the response and exchange information on COVID-19. But recently, in the past 2 meetings, the focus has been somehow shifting also to preparing for the 2020 hurricane season. And for this, the UN also relies, of course, on the network of offices, as Anthony mentioned, based in the hub in Barbados, covering the whole Eastern Caribbean countries and territories. But beside that, we also have a hub in Jamaica, in Trinidad and Tobago, in Guyana, and Belize. And my peers, resident coordinators, as well as other UN agencies there, having offices, are of course to be mobilized if case requires to work hand in hand with CDEMA to respond to the member states' requirements. As UN agencies, of course, we count with experts pre-identified and to put them at the disposal of the member state and CDEMA so that we can deploy them, of course, with depending on the sanitary situation for regional travels, but basically to undertake together needs assessment. And that is a very important element of preparedness that we always need to have well organized and well updated. So coordination and expertise includes always for us the establishment of an internal United Nations mechanisms of what we call a UN emergency technical team, and that is meant to bring coherence and unity for a one UN coherent response and support, starting from here, this hub in Barbados, but throughout the Caribbean, so that we work as one as well with CDEMA. And in that connection, I want to mention OCHA, that continues to give very critical support and technical assistance to CDEMA in the area of information management. And they also, of course, through this their technical assistant will continue to work with a different resident coordinator. And they are currently in the process of recruiting two specialists to be based here in Barbados in my office. And those specialists will be able to provide, of course, that support to CDEMA. I want to mention the issue of regional stocks and prepositioning of items, because this is very critical for quick delivery to member states. And I'm sure Liz will mention about that, but as UN agencies, at least I can mention that, for example, UNICEF, through the MOU with CDEMA, have already prepositioned supplies in Antigua and Barbuda, Barbados, Trinidad and Tobago, and that includes various hygiene and kits, tents, and school in a box, for example. WFP also have prepositioned emergency response kits and equipment for emergency logistic hubs in 4 sub-regional focal countries in Antigua and Barbuda, Barbados, Jamaica, and Trinidad and Tobago. And of course, that is to be mobilized under, again, the CDEMA IRM. PAHO, as usual, has always prepositioned basic medical kits, and they have also recently produced interim guidelines for the shelter management, taking into account the COVID-19 requirement, and this has been made available. Finally, in logistics, WFP continues to strengthen logistics with the RRM, including with the establishment of the integrated regional logistic hubs in Barbados, and co-leads the logistics sales of CDEMA in the regional coordination center. And this is really a result of what we have gone through during the response to the COVID crisis, as those supplies now, or this mechanism now is in place and would be relied upon in the event of any natural disaster, should there be a need for warehouse management or air bridge to be established as required. Finally, I want to say that the UN system has updated its contingency plan and is about to test it very soon in collaboration with CDEMA, and it includes standard operating procedures that we expect to undertake from pre-impact through response, and taking into consideration the priority for preparedness and response actions by sector. I really want to end by saying that the UN development system recognizes the regional response mechanisms as very working system through which support can be provided to the Caribbean in a very collaborative way. This is, in our view, very important to have these mechanisms well established, well working, and well coordinated. And we also appreciate that any response to the usual threats of storms or hurricane in the context of COVID-19 for 2020 will certainly pose a unique challenge to all of us. So more than ever, any response will require a true collective effort which we commit to undertake with CDEMA and our national counterparts in countries to deliver effective response. And we're together in this. I could end with those words. Thank you very much. Over to you, Anthony.
Very good words to end with. We are together in this. As Dario Brathwaite, the UN Resident Coordinator for Barbados and the OECS. And if you have any questions for Mr. Brathwaite, you can take note. We will have a question and answer segment immediately after our next presentation. You can begin to share your questions with us. Of course, you can indicate by the raising of your hand as well that you want to pose a question. But first, we will have our next panelist, Ms. Elizabeth Riley, Executive Director of CDEMA Acting. Ms. Elizabeth Riley was appointed Executive Director Acting at the Caribbean Disaster Emergency Management Agency, effective May 1st, 2020. She joined the team in 2001, the CDEMA Coordinating Unit, and was appointed Deputy Executive Director in April 2012. She also acted in the deputy position between 2009 and 2012. Ms. Riley has over 20 years experience in the area of disaster management at the regional and international levels in various capacities. And as deputy, she held overall responsibility for the agency's technical programming and provided strategic guidance in the areas of preparedness and response, mitigation, recovery, education, and training and information management. Here she is in her role of Executive Director Acting. Good afternoon to you, Ms. Riley.
Hi, good afternoon, Anthony. And first of all, allow me to express my thanks to the CBU for graciously agreeing to work collaboratively with CDEMA on our annual press conference this year. I also want to thank the UN Resident Coordinator for willingly accepting our invitation to support this year's press conference. For us, this is very important because the work of CDEMA is really executed through partnerships at the national level with our participating states, and of course with our regional and international partners. So Mrs. Grosvenor set an excellent context in her opening remarks where she spoke about the recently updated forecast for the 2020 season. And you will note that the language of the Colorado State University has changed to well above average. And I think it's important for us to note this. So CDEMA, as you may be aware, leads what we call our regional response mechanism. And this is a facility which harnesses the collective capacity of national, regional, and international actors to support any of our participating states which is adversely affected by the impact of a hazard. In fact, under our mandate, we have a requirement to mobilize and coordinate disaster relief for impacted states, also to provide immediate and coordinated response. And we also play a critical role with respect to information sharing. And in this regard, our relationships with media houses across the 18 participating states are absolutely valued to us. So if we have a look then at the whole issue of operational readiness, this is identified as a critical plank of our comprehensive disaster management strategy, or CDEM, as well as the resilience framework. And both these guidance tools steer the direction of the work of the coordinating unit. For the 2019 to 2020 programming year, we had since last year developed a comprehensive operational readiness program, which comprises training, exercises, scenario planning, plan expansion, as well as enhancement. And of course, given the rollout of the various scenarios this year with the drought, COVID-19, we've taken a proactive approach in revisiting our operational readiness program in 3 areas. 1, adaptation of planned actions to integrate COVID-19 considerations and to strengthen planning within this COVID-19 context. 2, modifications of the timelines for planned operational readiness actions to facilitate delivery of critical response actions for COVID-19 in support of our states. And 3, we saw this as an opportunity to really concretize the leadership role of the coordinating unit in regional coordination through the regional response mechanism and to deepen our strategic partnerships. And in fact, at the national level, our participating states have also signaled to us that the COVID-19 outbreak has provided a jump start on their national preparatory actions for the 2020 hurricane season. And it should be noted that COVID-19 is impacting the region during the period when many critical elements of this operational readiness program were scheduled for implementation. And as a result, both the coordinating unit and the participating states are in operational mode at a time when intensive readiness actions are traditionally scheduled. But first, let me deal with the whole aspect of the COVID-19 and to say a little bit about what the CDEMA system has been doing to facilitate and support the regional efforts. So from our side, emphasis has been placed on the enhancement of multi-sectoral coordination of multi-hazard emergency events in the region through our regional response mechanism. And as you know, the RRM provides that space for regional institutions and international partners, inclusive, of course, as you heard from Didier, within the UN family, to work together towards common results of supporting member states through crisis. We have, in fact, at the coordinating unit, produced 5 supporting documents for our states to assist them and guide through this process of COVID-19. We prepared a regional protocol for the management of COVID-19. This was done collaboratively with a range of our regional institutions. We also prepared our operational plan for COVID-19, a continuity of planning reference guidance note for our states. We have a policy internally on remote working arrangements as a result of COVID-19, since many of our entities, of course, have shifted to telework. And we also prepared a specific pandemic annex to the internal CDEMA contingency plan. Now, with respect to the regional level engagements and coordination, CDEMA continues to lead the multi-sectoral coordination in support of the CARICOM Technical Lead for Health, which of course is the Caribbean Public Health Agency, or CARFA. Our Regional Coordination Center has been activated since March of 2020, and we continue to liaise with CARICOM institutions towards supporting the strengthening and continuity planning, as well as regional coordination. We are also working very closely with our health sector partners, CARFA and PAHO, in collaboration with the CARICOM Secretariat to strengthen the health sector coordination and response. And in fact, we've set up a specialized cell within the Regional Coordination Center, which is treating with particularly the health issues, since the health information is really the fuel that is driving the engine of the regional response mechanism. The regional protocol, which was designed to support CARICOM states in their response to COVID-19, as I mentioned, was developed in the support, very strong support of the CARICOM Secretariat and through contributions of our regional agencies or institutions of CARICOM. And to support country response and response in an evidence-based way, we partnered with the University of the West Indies through the George Allen Chronic Disease Research Center. And the University of the West Indies has supported us in our analysis cell in the development of modeling and surveillance products. These are available through the University of the West Indies website, but also can be accessed through the CDEMA website. And we encourage our media houses to visit regularly, because you can get very succinct, well-packaged information on the status of the COVID-19 event in each of the participating states, as well as regional synthesis information as well. So it's a very useful go-to for our media partners. Within the Regional Coordination Center, we have our logistics and procurement cell, which is working on strengthening the regional logistics and supply chain arrangements for the region. And as Didier mentioned, we've worked collaboratively with the World Food Programme in setting up the Integrated Regional Logistics Hub. And the setup of this hub is almost complete in Barbados. And the intent here is to facilitate the reception and onward movement of emergency supplies. And even though we've set it up in the initial context of the COVID-19 and being able to provide those necessary medical devices and supplies to our participating states, the hub is also going to be operational throughout the hurricane season and will support our logistics arrangements in support of our states. We also know that national disaster offices have activated their national emergency operations centers and are providing support to their national health EOCs. So there is a full package that the coordinating unit has undertaken in support of our states, and our regional coordination center, it remains activated and supporting our states as we go through this process. Now, I specifically want to turn attention to the hurricane season. And of course, Ms. Grosvenor, in her context, outlined that this is a hurricane season with a difference, because not only are we seeking to address and manage the threats that are associated with not just hurricanes, but also severe weather events, we also are dealing with the reality of the ongoing drought, and we have this additional complexity of COVID-19. So the question that I'm sure you're asking is, what is CDEMA doing differently for 2020 to ensure that we are really addressing the multi-hazard context? And there are 5 areas I'm going to treat with. The first is related to how we have accelerated our readiness actions for this year. And internally, we have a coordinating unit readiness checklist. And this checklist addresses a range of preparedness actions, which the coordinating unit team has been addressing since January. So this includes the update of our standard operating procedures, reinforcing and confirming our memorandum of understanding, including with our private sector partners for their support for the season, as well as updating and the maintenance of the functionality of our regional coordination center to make sure it is operationally ready. In fact, we have also instituted internal protocols at the coordinating unit to allow us to effectively run the regional coordination center while still observing the guidance of our public health professionals related to our physical distancing requirements for PPEs, etc. So this is something that we have fully integrated into the operations of our coordination center. We've also reviewed and updated the CDEMA contingency plan, our regional coordination plan, and I'll speak a little bit more specific on the plan issue in a few moments. We have also ramped up the execution of simulation exercises to test regional and national plans, and we've taken our countries through these phases, updated our emergency databases, and I'll talk a little bit in terms of personnel available for the system a little bit later. Very importantly, we have moved forward with the testing and confirmation of our emergency communications equipment and protocols for the CDEMA system. And an important part of this is ongoing weekly communication checks with our participating states as well as with our partners. The training of the deployment teams is underway, and I'll speak a little bit more about that shortly. We've restocked our deployment kits for deployment teams, confirmed the stocks within regional warehouses, and we continue to provide assistance to our states with their national preparedness activities, addressing these requests as they come in, but also undertaking particular webinars and training sessions for our countries on areas which we have together identified as areas of need. We have also updated the Model National Readiness Checklist, and our participating states are in the process of completing the checklist and returning those results to the coordinating unit. And we anticipate having a full picture of the status of readiness for the hurricane season by the end of June, ahead of our council meeting. The second area is related to our enhanced and adapted exercise program. And this has been ramped up and amended within the context of the COVID-19. So the CDEMA flagship exercise Synergy 2020, was convened just last week on May the 25th. And this was a very successful exercise conducted this year, of course, remotely. And it is, I think, very interesting how we have really been able to adapt as a system and really as a society to the new norm of operating via the technology. And I think it is working quite well. We had 97 participants in the exercise synergy for this year. And this exercise is designed to test the joint coordination among partners of the regional response mechanism. And it provides a forum for orienting our partners to their complementary roles in keeping with their disaster mandates. And you would have heard from Didier how the UN has also been incorporating these elements into their own planning. Now, the activity allowed us to focus on critical scenarios, and these are important because we looked at the regional coordination of within the context of a second wave of the COVID-19, and this is a possibility based on the briefings from our health colleagues, and certainly within the context of the conversation of our states with the reopening of borders. So we felt this was a very timely conversation to have, looking at the possibility of a second wave. We also looked at the whole scenario of regional coordination of a major hurricane impact amidst the COVID-19 crisis, looking at those specific complexities that we had to address this year, and really checking to see how our plans weighed against working through the scenario, to see where the gaps were and how we could specifically improve those operational plans. The scenarios for the exercise synergy also included the transition from response to recovery within the COVID-19 context, just looking at this new normal. So what then were some of the key takeaways? Well, first, we have identified the importance of the exercise in facilitating information exchange, and also the generation of specific recommendations and good practices on how we can strengthen our enhanced coordination. It also provides an enhanced understanding of the linkages between the recovery mechanisms at the national, regional, and international levels, and how we can enhance these towards better recovery frameworks for the region. There was also the benefit to coordination of emergency logistical arrangements through the integrated relief logistics mechanism and hub, and we were able to simulate that during the exercise as well. The second major aspect of the enhanced exercising program is related to the CANSEC. This concluded actually yesterday, and this of course is led by our colleagues from the United States Southern Command, but we partnered with them this year to run an exercise, a hurricane-based exercise within the COVID-19 context during the session yesterday. So it was a full exercise. We had participation of over 100 participants again in this exercise. And some of the key recommendations pointed to the need to really strengthen and reestablish some of the arrangements that we have at the sub-regional level. And we also had the opportunity to talk a little bit about the definition of the protocols and guidelines to prevent or mitigate the human-to-human transmission of COVID-19 whilst we're delivering our surge support to our states this year. And this is very important. We're in discussion with the Caribbean Public Health Agency in keeping with the political commitment to regional solidarity, and we will be guided by the regional position on addressing the matter of the borders and how our surge support teams will interface at this level. I think one of the key messages though is that we have agreed as partners on a policy of do no harm. So our external partners, military and non-military, fully appreciate at this time through our exercising that we want to ensure that they are taking the necessary measures with respect to ensuring that we are not exposing populations who are to benefit from surge support to any additional risks from COVID-19. And similarly, we want to ensure that those providing surge support, whether from the region or externally, are also protected from contracting COVID-19 as we deliver our support. So this is at the forefront of our minds. The third key area has been with respect to enhancement of plans and protocols, and quite a bit of work has been done here. We would recall, and I know COVID-19 in some ways has overtaken the media attention, but we have not forgotten the important lessons which emerged from the Hurricane Dorian experience in the Bahamas just last year. And there was quite a bit in terms of the lessons emerging from the after-action reviews. And within that context, we have updated our tropical weather disturbances hazard annex. And in addition, we have developed additional annexes for the regional coordination plans to treat with the tsunami hazard, the epidemic pandemic hazard, and we've updated on earthquake, volcano, emergency telecommunications, the regional coordination center, and as I mentioned before, our contingency plan. So from the planning perspective, we want to ensure the message goes out that we've looked at it from a multi-hazard context and strengthened the plans within that context. So I also want to speak now to the aspect of the response teams, because this is the fourth key area. As you know, we in the CDEMA system have organized ourselves for horizontal cooperation, and regional cooperation and solidarity is really the mantra. And the coordinating unit is a tangible demonstration of the functional cooperation at the level of CARICOM, and this is something that we're very proud of. The regional response teams, comprising a total of 140 trained personnel, are on standby for deployment if required. These teams include the Caribbean Operational Support Team, which provides surge capacity to emergency operations centers, our Caribbean Damage Assessment and Coordination Teams, which provides surge support for countries who may require assistance in undertaking damage assessment. We've also put in place contingency arrangements for the delivery of services through the CARICOM Disaster Relief Unit, or the CDRU. And this is, of course, our unit that provides surge support to assist with relief management in country. And due to COVID-19, we could not undertake the training of the identified 2020 team. So in collaboration with the regional security system, we have called back up the 2018 and 2019 teams, which were trained. These comprise 70 personnel from our military and paramilitary organizations, and these are available for support to our participating states. So there's been no disruption to the availability of that surge support for our countries. We're also having discussions coming out of the Irma, Maria, and Dorian experiences on arrangements for how we can have a specialized technical team to provide psychosocial support. And we are well aware that the psychosocial support is an area which has been at the forefront even within the context of COVID-19. So other deployment considerations, of course, the question you're probably asking is, how do we keep our deployment teams safe within the context of deployment in a COVID-19 environment? And in this regard, we've consulted with the Caribbean Public Health Agency, and we have identified and confirmed the necessary personal protective equipment, which will be required for the deployment teams. And whilst we have some in hand, we are seeking to enhance to ensure that at any time the deployment teams are called out, that we do look at this matter of personal protection and safety of our personnel, recognizing that we have limited skill sets and human resources in this region. So it's very important for us to keep our teams safe. We are also ensuring that we look at aspects such as the insurance coverage for our deployment teams. Of course, this year we have the added dimension of the COVID-19, and we want to ensure that they're fully covered because this is a part of our internal commitment as a coordinating unit to the persons who support the system. So finally, I wanted to, well, before I go there, just one other point on the deployment. There is a reality that we may face some time lags or delays in the speed with which the response team can get into country. For that reason, we have emphasized to our countries the need to ramp up their national level readiness so that they are in a position to handle immediate aftermath of the events, with the understanding that our teams would come in possibly a little bit later based on the protocols. And we've also been working with another UN agency, the ITU, in collaborating on how we're going to preposition specific equipment. In fact, the ITU has given a commitment that they will be prepositioning emergency telecoms equipment in Barbados ahead of the season so that we have ready access to that. And of course, the communications are going to be very key to allow us to, among other things, provide remote support to our participating states in the interim as we work to get the teams in. So these are the arrangements we put in place for that. And finally, the direct support to our participating states. And I really want to underscore this because we have been working very closely with our states as we've gone through this process. In fact, we have weekly coordination meetings with all our national disaster coordinators. We have prepared a range of guidance documents for them, including relating to the treatment of and management of shelters within the COVID-19 context. We're getting some support from the Caribbean Public Health Agency in this regard to ensure that the guidance that goes out to states is in keeping with the appropriate public health protocols. And of course, the national level entities will at the final instance be guided by their health authorities, but we are providing overarching guidance for this. We also have taken into consideration from the shelter context and the guidance note, gender-related considerations, physical distancing, water, sanitation, hygiene. A lot of this has been supported, of course, by CARFA. And we're also in discussions around the whole aspect of the treatment of the vulnerable. We are well aware that the situation with COVID-19 has created a scenario where we have an increased number of persons who may require assistance from the state as it relates to perhaps provision of shelter, provision of relief management, etc., because there has been significant livelihood disruption. So this is one of the areas that we're talking through with our states and working hand in hand with them to try to address. So I think these are the key messages that I want to share for today. I am very much open to any questions or comments that the members of the media may have, and we look forward to engaging in the Q&A. Thank you.
Thank you so much, Elizabeth Riley, Executive Director, acting at CDEMA. Very thorough presentation indeed, and we look forward to the conversation that will now take place. Of course, the media is an important stakeholder here. You've mentioned quite correctly, Ms. Riley, that your partnerships are important, and we have the media represented here throughout the Caribbean. Big thank you to CBU, again, for making this possible. You can ask your questions, you can message your questions, or you can raise the hand and be acknowledged, open your mic and ask your question. Now while your questions come, we do have other members of the District Emergency Organization here with us on the Zoom call. Very special welcome. Thank you for joining us. And also other members of the UN agencies as well. Thank you so very much for joining us. As far as the media is concerned, I can tell you that we have representation from St. Kitts and Nevis, Trinidad, Anguilla, Turks and Caicos, Dominica, USA, Antigua and Barbuda, Belize. You have St. Vincent, Colombia, Anguilla. Those are some of the people that signed up. And of course, right here in Barbados. And when you do open your mic to ask a question, it'll be good if you can say which country you're from and which media you are representing. So we will now open for questions. Just to give a brief review, of course, available to answer your questions will be Ms. Riley and Mr. Trebek. Mr. Trebek spoke, of course, of health facilities, test kits, the current COVID protocols remaining very critical, the importance of coordination, entities such as the UN and CDEMA, as is happening even right now in this Zoom meeting, is testament of that. Support of medical kits and coordination of logistics, the logistics hub right here in Barbados, and also the UN contingency plans. And Ms. Riley spoke at length on a number of issues, including the regional response, the coordinating of disaster relief, which of course remains a priority for CDEMA, information sharing, operational readiness. We went into the simulation activities that were part of the recent training, testing of emergency equipment, training of deployment teams, the exercise synergy, which I found to be very interesting as well, focus on critical scenarios, one of those being the possibility of a second wave, and that also is very interesting. So it's all yours. Those of you now from the media that want to pose your questions. The first question I have is from Morland Madden. He's from the Nation newspaper, Barbados Today. And he says, have there been assessments of hurricane shelters in Barbados as yet? If so, how far along are we? And with the pandemic still lingering, what recommendations or plans are there in relation to preparation of the hurricane shelters across the country?
Thank you. Anthony, I will take the question, but I will turn it to a broader regional context. Because I wouldn't want to speak specifically on Barbados. That, of course, would be the remit of the Department of Emergency Management. But I can speak broadly to the conversations that we've had across our 18 states with our national disaster coordinators. And the matter of shelter management for 2020 is being taken very seriously by all of our states. Of course, the COVID-19 reality is what the reality, that it's delivering for us is that we now have a situation where there is a reduced number of persons who can be accommodated in established shelters. So all countries are going through a process where they are looking, one, at a deeper promotion of the principle of home as shelter, because we want to ensure that we are able to alleviate pressure on existing shelters to the extent possible. So persons are being encouraged to shelter either at home once the home facility is safe, but also to explore sheltering with family and friends, because this will alleviate some of the general pressure. Secondly, countries are all in the process of looking at additional options for shelter, which means that they have to undergo the process of not only identifying new facilities, but also undertaking the requisite assessment of those facilities. And even when the assessment is completed, as I suggested in the presentation, I didn't go into full detail, but there are certain requirements that we now have to examine within shelters themselves to make sure that shelters are ready. And these include, one, the physical readiness of the shelter plant to shelter persons in a COVID-19 context, because we have to ensure that we have adequate water facilities and water quantities. We remember that COVID-19 is requiring us to have a very ramped up hand hygiene regime. So this requirements for water, in fact, CARFA has provided on their website, and we are guided by this on requirements for water and sanitation and hygiene considerations. So this we're incorporating into the guidance for our states. But apart from the physical components, where we of course need a greater square footage of being available for individuals now in the shelter, which means reduced capacity, we also have to look at the side of the shelter management. And the countries are also working on addressing additional training for our shelter managers and shelter teams, because the shelter teams have to be able to understand what are PPE requirements, not just for them as persons managing the shelters, but also for persons within the shelters. And in fact, one of the recommendations we've made to the states is to have stocks of personal protective equipment within the shelters, because we cannot make the assumption that all persons who are coming to a shelter will have the means to be able to come with the requisite PPE requirements, masks, etc. So to ensure that we are maintaining the guidance of the health authorities in terms of the protocols that they have provided, the state has to provide a measure of support as well. And this is a place where the private sector can, of course, chip in, recognizing that countries, of course, are financially constrained at this time. So this is a space definitely for private sector partnership. So I hope that assists a bit with the question that was raised by the representative. Over.
Thank you, Ms. Reddy. I imagine as well that with the COVID-19 protocols in place, you did say that at the national level, the shelters are being reviewed, but it means that you would have to have a whole new posting. No postings of hurricane shelters are done annually, but those postings, we could expect some changes there because of the square footage that is allowed per person. Now, in terms of the information and availability, can we find these specific protocols to hurricane shelters as yet? Or is that going to be left to the national entities?
Well, from the CDEMA side, we have provided guidance to the states, but we fully recognize that at the national level, the public health authorities are the ones with the ultimate responsibility in country for giving that particular guidance. So I know that in a number of the states, they have sought to refine the shelter guidance with the specific, under the specific guidance of the ministries of health and particularly the public health professionals. As to whether those have been made available nationally in the states, this is something I would have to check in with the National Emergency Management Coordinators to see. I am aware, though, that a number of the states in their annual press briefings for the hurricane season, many of them started since the 29th of May coming through to this week, that they have been speaking specifically to this issue and sharing information with the population via the annual press conference. And I also am fully aware and confident that our national disaster coordinators totally appreciate the importance of ensuring that there is the appropriate information sharing with the public on any changes or modifications to designated shelters for the year, as well as protocols. Over.
Thank you. This question is for you, Mr. Trebek. Could you shed more light on the planned specialist assistance what areas and how many individuals are to come to be based in Barbados, and how soon? And that question is also from Marlon from Barbados today.
You mean in case of a natural disasters?
You can indicate if that's so, Marlon, but I'm assuming so that he's referring to when you spoke of specialist assistance being available.
Yes. Well, I'd like to add to first on the shelters and complement also what Liz just mentioned. PAHO has also provided some guidelines in line with what to all the ministries of health in the region, in line with what Elizabeth Riley just mentioned. And they have put forward some preferred sheltering practices for ministries of health, you know, covering the shelter and space management, infection control and prevention, and hygiene standards, but with also some very specific COVID-19 precautions in terms of referring to testing centers, social distancing, of course, early detection and waste disposal. Just to complement this, so that is being, of course, worked out as well with CDEMA. Look, in terms of the response, it depends. I mean, it's very difficult today to speculate on the magnitude of a response and what would be the capacity that we will mobilize and bring eventually to one country in order to support the response. It also depends on the phase of the disaster, and perhaps Ms. Riley can also mention the phasing system that exists in the regional response mechanisms. What I can say is that as UN system, we have different hubs in the Caribbean. Here we are more than 200 people here based in Barbados, and there are also staff stationed in Guyana, in Trinidad and Tobago, Jamaica, and in Belize within hubs. And we of course have several experts disseminated in the various islands. So should a natural disaster strike, of course, we'll put together, if we are requested to do so, to get started, a needs assessment team. And that's where, together with CDEMA, we have worked in pre-identifying experts readily available in the region already, in the Caribbean region. And of course, then when comes the time of the response, then we'll of course respond as necessary and based on the request from the member states in coordination with CDEMA.
Thank you very much. Kim Budram, we see your hand. Thank you so very much for participating today. Go ahead and ask the question.
Good afternoon. Am I being heard?
Yes, we're hearing you.
Okay. Yeah, thank you. Good afternoon. Kim Budram from the Trinidad Express. Thanks for having me. So what has happened is that I did lose you guys a little bit because of internet problems. So I just hope I'm not being repetitive. I don't want to ask specifically for Trinidad and Tobago to only be addressed, but you know, of course, that's what happens. So for instance, Trinidad and Tobago has a very high population of persons with NCDs, and you know, persons like Mrs. Riley and Mr. Tribok, I'm so sorry, I don't know if I pronounced that correctly, have spoken about the complexity of coping with the season, the possibility of an event in the context of COVID. Resources are already, you know, a little bit strained maybe in some places, or at least resources have to be maintained because we are preparing for second, possibly third waves. So I guess what I really want to ask is are you all satisfied with the readiness of your membership states? Are there any states standing out that have caused you concern, that you feel they have not addressed specific things about their own needs in the upcoming season? And of course, if there's anything at all relevant to Trinidad and Tobago that you have noted that you would mention to me today, I would appreciate that. I hope that was not too general. Those are my thoughts.
Thank you so much, Kim. Ms. Riley, are you going to take that?
Absolutely. So thanks very much for raising this question of the national level readiness. I did touch on it a little bit in the presentation, and I had mentioned that we have out for completion by the states our national readiness checklist. Some of the states have completed it, and of course, the approach that we take when we analyze the results from the readiness checklist is really to give it a lens from a regional overview. Country level specifics we will discuss with the individual states, of course, with a view to addressing specific gap areas that they have identified. What I will say is that I am satisfied with the level of seriousness with which our states are taking the readiness for this year's season. I'm satisfied with this because the participating states, I think they have done, honestly, a very tremendous job. We have to bear in mind that in many instances, national emergency operations centers and national systems have been activated since about February. In fact, in some cases, the health EOCs have been activated and working since January. And then the full national EOCs have been working since about March or so. And with small teams, the teams have really been working, as we say in Caribbean parlance, flat out. And the reality is that even within the context of addressing the COVID situation, which they're required to as a national coordination mechanism, they have definitely not lost sight of the importance of dealing with the readiness for the hurricane season. I know we've seen very early systems this year, and what it means is, of course, that we have to accelerate those readiness actions. But countries are working. I think we have to appreciate that this year it is a process, because part of what is happening this year is that we're also learning as we're going. And I think having not had this type of a scenario play out before, and which is why we were doing this scenario planning, we were really encouraging states to think through what are the possible scenarios that could play out for this year. So I would say we're satisfied with the level of seriousness with which the countries are taking, and we definitely want to be able to support them as they go through the process.
Thank you very much. We did have an overview of the 2020 hurricane season by Ms. Grosner earlier, and you alluded to the fact, Ms. Riley, that we had a situation where we have seen systems already. Now, the number of systems that we've seen this early, is it unusual, and therefore lining up with the forecast that we are seeing?
Yes, thank you for that question, an excellent question. In fact, Cristobal, which is the third named storm for the season, has set a record. It is the earliest date when we've had a third named storm for the hurricane season. So that is actually a record. We have had situations before where we've had named storms prior to the start of the hurricane season. So that has happened before, but definitely the third named storm, that's a record. Over.
Thank you. We do have a question coming in from Vibes Radio. I believe that's in Dominica. Caribbean islands have to come to rely on regional and international support in the aftermath of a weather-related disaster. It is given that the global financial crisis is a consequence of the new coronavirus outbreak. Regional nations should not depend on that help. I'm just paraphrasing and going through so I can get to the question. What sort of preparations has CDEMA made to spring into action on behalf of regional nations in case of emergency? So I think what is being put forward here is that, you know, we have an unprecedented economic situation on our hands globally. And this means that nations and regions, you know, they're going to be more challenged even to take care of themselves in a disaster, and will rely on international help. We've heard, of course, the pleadings with the climate change conversation has gone out loud and clear on behalf of the Caribbean. And SDA is now, in terms of what is being asked here, what sort of preparations has CDEMA made to spring into action on behalf of regional nations in case of emergency?
Yes, thank you very much for that question. Another excellent question, because I think what it indicates is the recognition that with the global impact of COVID-19, that there is a potential for some constraints with respect to the level of support that could be provided from our traditional support partners, whether these are from government support or whether it be from non-governmental organizations who support the humanitarian landscape. And it's a very important observation. In fact, I participated in a webinar with the OAS just earlier this week, and they presented the results of a survey where they indicated that a significant percentage of humanitarian actors in the NGO sector are indicating that they're not in a position to provide support, or if they provide support, it will be scaled back. Now, recognizing this is a discussion we had internally, in fact, since about February, internally at the coordinating unit. And we have reached out to our partners in a very direct way to ask this question, particularly as it relates to the military, the militaries of our partner nations. And we've had a very direct conversation with respect to what can we expect if we have what we refer to as a level 3 event. This is what Didier was referring to earlier. And the level 3 event is one where the national level capacities for managing the event are completely overwhelmed. And we have to bring the regional as well as the international support to bear. And I'm happy to say that in the majority of instances, the military partners from our partner nations have indicated that yes, they will be in a position to provide support, but it will come within the context of the health protocols and our principle of do no harm. So these are the parameters which are going to govern it. So with respect to the second aspect of the question, I would just refer to some of the areas which I had outlined a bit earlier. So I talked, of course, about the operational readiness and the areas that we address under our operational readiness checklist. I had talked also about the plans enhancement, where we have articulated an operational plan for the hurricane season 2020, taken into context the COVID-19 scenario. We also talked about what has happened with the deployment teams, where we have put certain contingency arrangements in place for deployment teams to ensure that we still are able to access personnel, because our system is built upon horizontal cooperation, and it's very important that we're able to draw upon personnel from our non-impacted states to support states that have been impacted. And I also spoke a little bit on the plans that were enhanced for the season in the contribution I made earlier. Thank you.
We have just about 10 minutes remaining, and therefore, if you have any further questions, I invite you to raise your hands and ask, or you can send me a message in the Zoom group chat. I have a follow-up question, maybe fairly similar to the last one, but I would ask, and I do appreciate, you see, the advantage of having a meeting such as this with our counterparts from across the region is that they will ask specific questions relating to their own experience. And we know that we've had some pretty bad experiences recently with hurricanes. So here's a question coming out of Dominica, and we have seen this happen. How capable is CDEMA of dealing with a worst case scenario of at least 3 islands badly affected at the same time and in need of support?
Yes, thank you so much for the question from Vibes Radio in Dominica. And you're quite correct, Anthony, in indicating that this is a scenario that has played out before. In fact, in 2017, where we had multiple CDEMA states In fact, when we did our after action review, in fact, we had 4 CDEMA states being severely impacted to a level where there was a requirement from the regional response mechanism coordinated by CDEMA. And certainly we took the opportunity to draw lessons from that experience. So in that regard, what we have done is we've expanded the number of personnel who are available to us to support deployments. We managed to respond to the requests in 2017, but we clearly saw that we needed to have additional search support on our databases, and we have done so. We also had discussions with our counterparts at the regional security system with respect to modifications that we could look at for some of the other teams, including the CARICOM Disaster Relief Unit, which is coordinated by the regional security system. And we have put arrangements in place to ensure that we have additional depth within that particular search support arrangement to be able to respond to more than the 2, which we provided that team, I should say, for 2 states during the 2017 event. So there was also the aspect of the revisit of the operational plans for the agency, because what we are seeing, of course, is that what is happening with the systems themselves, it is changing. And certainly the number of Category 5 systems that we saw in 2017, as many of our media colleagues are aware, it is really signaling a new normal and a different scale at which the regional response mechanism has to exist. And I also want to indicate that, interestingly, we are in the process now of concluding a review of our regional response mechanism. It's a mechanism that has been in place for over 20 years. And even though we revise and update the plans and operational procedures related to the regional response mechanism every year, once we have exercised that mechanism by responding to situations, etc., we fully recognize that there may be a need to reset the types of events that we expect within the region, and it will have an implication for what we plan for through the regional response mechanism. So it's an excellent question, which is really pointing to the need, a need that we have recognized for a relook, and we're in the process of doing that relook. But I would say that if we do have a scenario of multiple states being impacted, similar to what we saw in 2017, the system is ready to provide support.
We have a question from Belize. Marlene Seulari. I hope I have your name correct. I'm so sorry.
They are. That's fine.
But you're from Great Belize Productions Limited. Thank you for joining us.
Channel 5, yes. Now, my question is for CDEMA. You, in the readiness assessment of the individual member states, how much did you look at the individual countries' capacity to be able to manage both the COVID-19 outbreak as well as storm preparations and also post-disaster efforts?
Absolutely. I'm really happy to see Belize on the call. Welcome. So absolutely, yes. So there's a range of parameters that are identified within the readiness checklist, and it does take into consideration the aspect of the management of the 2 events simultaneously. One of the things that we need to bear in mind is that the COVID-19, as I mentioned in the presentation, is a health-led event. So the public health officials, as I know all of our media practitioners, you've been interfacing now with your national level public health officials, etc., disaster manager, etc. The public health personnel are the ones who really take the lead because it is a health-oriented hazard. What the National Emergency Management Office and the national system brings to bear is the national level resources that the health system indicates are required. So we do still have capability within the national level systems for coordination of hazards which may be generated by another trigger, whether it be a hydrometeorological, whether it be earthquake, whether it be a severe weather event linked to the hydromet, which triggers other types of hazards like landslides, etc. The central coordination would still lay within the remit of the National Emergency Operations Center. And I can tell you that this is a conversation that has engaged our National Emergency Management coordinators as well, in terms of practically how would they go about the management of the two events if such a scenario were to play out in both the COVID-19 and a second event as well. So this is something that has received the active attention of the national offices.
Thank you very much. Felipe Alarcon, in addition to the last question, what about the other kinds of disasters? Probably most common ones are earthquakes and tsunamis, and probably forest or landscaping disasters like wildfires. And this is something that you did allude to earlier in your presentation as well, Ms. Riley.
Yes. So our comprehensive disaster management strategy, Ms. Grosvenor mentioned it at the opening, and I mentioned it also in my presentation. The principles of that strategy are about all hazards, not zeroing in on our hydromet hazards, which tend to receive quite a bit of attention. And in fact, we can see the reason why we always promote the message of all hazards, because COVID-19 is a hazard, but it's a hazard that is a health-related hazard and biological in nature. So the treatment of hazards within the CDEMA system, within comprehensive disaster management, it emphasizes that we need to look at the full range. And in fact, as our colleague from Vibes Radio in Dominica knows, one of the areas that we're tracking and monitoring right now, along with the Seismic Research Center Trinidad, is the whole issue of volcanic activity in Dominica. So this is an area that we have been monitoring. I know it's been in the press as well, and I really want to thank the press for ensuring that these types of hazards, which often do not get a lot of attention, that I've been seeing frequent reports in the media coming out about the volcanic activity. We also know that we have hundreds of earthquakes in the region every year. So these are hazards which we have to ensure that we keep them at the forefront, notwithstanding that we're in the hurricane season. The key message that must go out is that we have to maintain a high level of readiness for the full scope of hazards that affect our participating states.
Okay, we're getting ready to wrap up. Kim from the Trinidad Express has another question.
Hi, I'll make it very quick. Again, if I missed it, sorry. Just to ask about other illnesses in the area, dengue, Zika. We had a couple of them around. To ask about any status overview according to CDEMA as to where those illnesses are in their numbers, and again in the context of rainy season, COVID preparedness, regional corporations needing to ensure proper drainage in each member state, that sort of thing. Any commentary on those illnesses? Thanks.
I will comment only insofar as to say that it's a discussion that we've been having with our public health counterparts at CARFA. In fact, this is an area that was signaled by CARFA very early when we recognize that as we learned more about COVID, and we recognize that we have to learn how to coexist with COVID, that we have to keep our eye on other health-related diseases, which are outbreaks of which are usually associated with the wet or rainy season. And of course, the chikungunya, dengue, Zika, these were on the list that CARFA indicated to us. I don't have specific statistics. I think that's probably a matter that could be best treated by the public health officials in country, and certainly by the Caribbean Public Health Agency. But I will say that this is an area that they signaled to us very early and asked us to ensure that we were bringing this to the attention of our national emergency coordinators as well.
Ms. Reddy, you did speak about a second wave, and I did note your, when you did say that you have a partnership with the University of the West Indies, looking at modeling products, and no doubt that would have been given some specific information about that possibility. How concerned are you really about a second wave at this particular time with the hurricane season expected to be above average?
Yes, I think that the public health officials, we are guided by them. So the evidence that is being produced on the public health side is what is informing the actions being taken by the coordinating unit. Now, CARFA and public health officials at the national level too are very conscious of the possibility of a second wave. And I think the commitment to regional solidarity by the heads of government of CARICOM, including the ongoing conversations on a suite of protocols that will apply when countries reopen their borders, are really designed to reduce the risk of the possibility of a second wave. And certainly as we go through the process of our states reopening their borders, and we will of course have the opportunity to see, and hopefully we have a positive message coming back on the level of effectiveness of the border controls and the health protocols that have been put in place with the border controls to minimize the risk of this happening. And as I indicated, thanks to the support of UWI, we actually are tracking what is happening with the COVID numbers in country, incidences of COVID, the cases in country. We track this on a daily basis, and we have cumulative graphs over time so that we should be able to pick up early trends if there are any upticks with respect to the number of cases being experienced in country. And we therefore would be in a position to, through the monitoring, to be able to make the necessary adjustments to deal with any other hazards, including the hurricanes.
Okay, Ms. Riley, it's kind of unfair that you get the last question because you've been in spotlight quite a bit, but it's already part of our wrap up. And I think it is a good question coming out from Dominica, I believe it is, Vibes Radio. And the question just simply is, how can we help how can regional islands preemptively help CDEMA to help them?
Oh, an excellent question. I think that's really an excellent question. I would say that an important part of it is actually, as I mentioned, on the readiness checklist, because the deeper our understanding at the regional level with respect to what countries are able to undertake, what their national level capabilities and capacities are, and very importantly, where they have gaps. This is really critical for us because we work from scenarios. So as in the case of a hurricane, for example, if a hurricane is approaching a particular participating state, we always do a scenario walkthrough with them so that at the end of the discussion, we have an understanding of, okay, if this system impacts us as a category 1, we anticipate that we will not require any support from the regional system. However, if it is a category 3, the potential areas that we see may be impacted are, and they would indicate to us particular geographical areas, which either from historical knowledge or from risk analysis will suggest that there's a requirement for support, and we would be able to generate figures, population figures, how many people may potentially be impacted, and therefore we know from the regional system, these are the things that we need to do. I think also the whole aspect of the support from the political level, and I think we have definitely seen a demonstration of that in the excellent leadership from the CARICOM heads of government level. Certainly this is a matter that has been discussed actively during the recent heads of government meetings. And I have to say that the heads of state have really demonstrated their commitment to looking at this whole issue of national level readiness, particularly for 2020. And for us, this is definitely an area where our states are supporting us. So there are different levels. I also want to say, though, before I close, that the partnership with the media is really critical, because I know we usually have a big flurry around June 1, but our media partners are so necessary for ensuring that this message of individual community preparedness, and you know, in my background, you will note I talk about partnerships for community resilience. And these are the important messages from the national level that we would like to see going out, and we really are counting on our media partners to assist us as we go through the season and through the experience of COVID-19.
Thank you very much. We are now wrapping up. I want to say a big thank you to Dario Brathwaite from the United Nations for your presentation, Andrea Grosvenor, Deputy Executive Director acting at CDEMA, and also to Elizabeth Riley, who is the Executive Director acting, Hilda as well. Hilda Cotsbullen, the Secretary General acting at the CBU, who, of course, the CBU, we thank the CBU for making this regional conference, media conference possible, and to you, the media, for attending. We wish you a very safe season. We know it's for, you know, above normal activity, but all of us, of course, must really hope for the best, and we continue to wish you as much safety in this environment. Thank you very much for attending this afternoon.
Thank you very much. Goodbye.
Thank you. Thank you very much, panelists, moderator, participants. Thank you.
Thank you very much on behalf of the coordinating unit. Again, thanks to all the members of the media who participated. Thank you to Didier for participating from the UN. We're always happy to have the UN participate. And to Mr. Green, of course, for your excellent moderation of the session. And of course, thank you again to CBU. And I have to mention my coordinating unit team. Mrs. Grosvenor was with us this afternoon, but we have an excellent team at the coordinating unit. And this is how we're able to do the work that we are able to do, because we have a very committed and dedicated team. I specifically want to thank Mr. Murray for all the coordination of today's session. Thank you.
Thank you very much, Elizabeth, again. Thank you for the partnerships, and Anthony. Thank you to CBU for the broadcast, and again, I want to thank my colleagues from the various UN agencies who've been there participating, but who contributed, of course, to the inputs that I delivered. Have a good end of the day.
Thank you. Take care.